Thank you, Davor, and we had very good discussions today. First, a few words on the migration situation in Greece and at the border towards Turkey. I was in Greece yesterday, and there have been very few irregular arrivals the last week of irregular arrivals of migrants towards Greece. But there's still, of course, a lot of attention that has to be put into this issue. I could announce yesterday that we are using in the action plan that we are presented for Greece, we are now launching a temporary voluntary return project that will return 5,000 migrants from the overcrowded camps at the islands. We will also help Greece with the relocation of unaccompanied minors, children, and other vulnerable groups. Yesterday, I could present that 7 member states are ready to relocate 1,600 unaccompanied minors from Greece now. At the meeting today at the Council, there were even more member states that signaled that they are ready to do relocation, or they are now considering to also join in for more relocations. Other member states signaled that they, at the conference that we're going to have in May on children, migrant children, they are ready to deliver also other kind of support for these vulnerable groups at the overcrowded camps on the islands and also in other parts of Greece. So this was a strong message of solidarity. Last week there was a strong message of solidarity in protecting the borders. Today it was a strong message of solidarity to helping Greece to cope with the situation with the migrants. Over to the coronavirus, that of course is an issue of great concern for many of us right now. The task that lays upon us as responsible politicians is, of course, to limit, contain, and to protect the capacity. And how should we deal with this? Of course, this is what all ministers of interiors are very occupied with right now. But we discussed how we also can help each other in this way. And when I especially talked about how we should deal with border management, and I used the word cope, because our efforts should be coordinated, operational, proportionate, and effective. And these are the things that we need to work on together. There was a strong supporter, and the member state asked the Commission to take a leading role when it comes to coordination of the efforts. And we are going to present guidelines for border management as soon as possible. I presented them orally today at the Council, and we hopefully can present them also in written later today. This is what we are working on. And that means how to give some guidelines for member states, what kind of measures can be taken. When it comes to external borders, there is always a check of people entering from the third country into the EU area. And there is a checking of the identity. There could also be, if a possibility to add medical checks towards these checking. If a person shows symptoms or in other aspects can be considered as a threat towards public health, it's a possibility to deny a person entry to the European Union on that basis. Of course, in many cases, it's better that to put a person in quarantine or to show some medical treatment than to refuse entry, but it's a possibility to refuse entry. When it comes to internal borders inside the EU, inside Schengen, it's always possible for a member state to have health checks. If they introduce health checks, it's not seen as an internal border control. So it does not necessarily have to be, what is called? they do not have to notify the Commission on that, so they can always do that. It's also, of course, possible to have border checks and to notify the Commission on that. But what I recommend and what the Commission recommends is that before taking these kind of measures towards another member states, we should coordinate these kind of decisions so that especially neighboring countries could be aware and have the same approach how to deal with this. There's also a question whether is there a possibility for the Schengen countries, for the Schengen area, to ban third country nationals to come in. It's not during the EU legislation to have an EU decision, but it's always possible for member states, if they act to coordinate, to take that kind of decision. But it's important that these kind of decisions are proportionate, and that's why I think it's very important that we coordinate these kind of border management inside the EU together with the member states. And this is the role that the Commission will play, and we will have a very frequent political video conferences on this issue to be able to deal with this problem together so that we can have a coordinated approach. One thing that is important to mention is, of course, that it's always, all member states always have to take back their own nationals, but it's also important that they help other nationals to come back to their country of origin. And we had a discussion in the Council of trucks being stuck at borders so that medical equipment can't be delivered, or that the drivers can't come home to their home country. And this is, of course, very counterproductive. So it's important that all measures are being proportionate and that we have a pragmatic approach so that we help the services and the healthcare services as much as possible, and that we do not hamper economic activities more than necessary. So the decision was that the Commission should coordinate this and that we should publish these guidelines.